So yeah, the Democrats are out there trying to go off and hit President Trump on his handling of COVID-19, saying that he mishandled it, and as a result, 200,000 people had died. They're going off and trying to promote this as an example of presidential failure. And they're being completely dishonest about the situation here. Now, here's Joe Biden trying to make the case.
Look what's happened. More than 210,000 Americans are dead. 420,000 have been hospitalized. We lose anywhere from 700 to 1,000 people every single day in America. Worse than any country in the world. More than 7.5 million Americans have been infected, and we're still counting.
Now, first off, let's try and examine this from a rational standpoint. If you thought that President Trump's handling of COVID-19 was horrible, was the biggest botch in the history of the U.S., then try to explain why Joe Biden's plan, the Biden-Harris plan for how they would have handled COVID-19, is just basically stealing Trump's plan. Try and explain that. If you think that Trump was so horrible, why have you ripped off his plan? Your entire plan consists of things that Trump has already done, some of which he is still doing to this day. You don't actually have a plan of your own. And, as Pence had pointed out at the debate, which was great, is that plagiarism is something that Biden knows a lot about. Biden has plagiarized throughout his entire career. He wants to bash Trump as having a horrible plan, mishandled everything. But here's my plan. I just ripped off Trump. Here's how I would handle it, and it would be better. Now, if you want to go off and try and determine whether or not Trump's response to COVID was good, was bad, had no effect, we actually have to start analyzing some information here. Now, first off, was 0 deaths ever a possibility? No. I'm going to flat out say that. As the Democrats were downplaying COVID in the beginning and comparing it to the flu, one thing that came up was that the flu, the seasonal flu, which we are all prepared for, handle every year, have vaccines for, still takes roughly 20 to 40,000 lives a year. On average, about 40,000 people die of the flu each year. So if COVID is much more transmissible and deadlier, let's say 10 times deadlier than the flu that takes 40,000 lives, was 0 lives ever a possibility in COVID? Well, a rational person would say no. So then we have to determine what level of deaths would be the determination of good response versus bad response. Okay, so some people want to go off and say that COVID is 10 times more deadlier than the flu. Okay, so if it's 10 times more deadlier and it's more, easily transmissible, because you are able to infect people before you get sick and naturally start quarantining. Okay, so you would expect there to be 10 times more deaths, right? So 40,000 times 10, that would be 400,000 deaths. If we want to try and do this on a, overly simplistic basis, then that means that the response to COVID, being at 400,000 deaths being the baseline, 200,000 deaths means that the expected number of deaths would be cut in half, right? I mean, if it's 10 times more deadlier than the flu, then we would expect that even with, what we do with the flu, people naturally self-quarantining because they don't feel good, having vaccines, and still 40,000 deaths, right? So 10 times deadlier is 400,000. Have we reached 400,000? No. So then one would presume that based off of only 200,000, our response to this has been more effective, on trying to make an apples to comparison. We are handling this better than what we do with the normal seasonal flu, right? Makes sense. But then let's also take a look at what the projections, the left is always saying, listen to the science, listen to the experts. Okay, so what were the experts saying? Well, the experts were off initially telling us that the expected amount of deaths, if we did nothing, would be 2.2 million people. 2.2 million. All right, we are at 200,000. Right? So 2.2 million, 200,000. So we're just under 10% of what the expected deaths are. That means that Trump's actions cut the death rate 90% from where they were projected to be, according to the experts. So based off of these different ways in which we can try and compare it, Trump's actions either cut the death rates in half, which is not bad, and it shows that he did, quite a bit. Or if we're going based off of what the projections were, he cut it 90%, which, is great. 90% is a great reduction in deaths. And this is all based off of the idea that 0 deaths was never a possibility. So you got to try and figure out what was within the realm of possible. And judge based off of either what the projections were, if you believe the projections, or doing a comparison, to the flu, and this being 10 times deadlier than the flu, but we're not experiencing 10 times more deaths. So no matter how it is you try to go off and really spin this, Trump has actually done a phenomenal job at handling COVID-19. But I get it. You're going off and you're wanting to tout the 200,000 number because that sounds really, really big. That sounds, massive. But as a percentage of the population, that's not really a big percentage. I mean, that's not even 1%. That's like a fraction of a percent of the population. And so you got to start realizing that, percentages and numbers, they're very different. The larger the number of the total population, the smaller the percentage of people need to be in order to feel like a big number. Now, of course, they also want to go off and say it's more than any other country in the world. Really? Really? Okay, so you want to compare us to, let's say, Germany? Well, Germany is about the size of a medium, to small state in the United States. So that would be what? 1/50th of the population that the United States have? Germany could have a 100% infection rate and still have less than the United States at just a fraction of a percent of a population. Or 2%, of the US population. And you can do this comparison with almost every other country in the world, where they could have 100% of their population infected and still have less total cases than the United States. There's only 2 countries that could have more cases, India and China. They're the only countries bigger than the United States in terms of population. And so they always try to go off and do this manipulation. Now, of course, they have another line of attack. Oh, the jobs that have been lost and will not come back. So let's hear what Joe Biden has to say about the jobs, the economic impact of COVID-19 on the United States.
My heart goes out to everyone struggling with the economic crisis caused by the simple neglect of this president. Nearly 11 million jobs lost since the beginning of this crisis. And they still haven't come back, including 136,000 jobs here in Nevada. Temporary layoffs have turned to permanent layoffs. Record growth last month in the number of Americans facing long-term unemployment. And the problem with long-term unemployment, once you get beyond a certain point, history shows us that they never get a job again.
Okay. So let's say we go off and we believe that, right? That all these jobs, they're just gone, and most people may not get their jobs back ever because they've been gone so long. Okay. But what would Biden have done? How would things have been done under Biden? Well, all we have to do is examine what Biden has said previously during the outbreak of COVID to realize things would have been much worse under Biden. Because remember, Biden is always about listen to the experts. Listen to the science, he proclaims. Okay, so when Trump was going off and creating the coronavirus task force, when Trump was issuing travel bans to infected areas or infected countries such as the Wuhan province of China, what was Joe Biden doing? Joe Biden was denouncing that as hysterical xenophobia. He was attacking it as an overreaction. He was saying, listen to the experts at the WHO. The WHO, who at the time was telling everyone there's no reason to panic. There's no reason to take any action because the experts have determined that based off of the science, this was not human-to-human transmissible. That there is nothing to worry about. So if we were listening to the so-called experts, as Joe Biden proclaimed, we would have delayed actions. We wouldn't have taken action as early as we did, which means the infections would have spread much faster in the beginning and would have spread much wider. Okay, so we know based off of Biden's reaction as Trump was taking action that Biden wouldn't have taken action, which seems par for the course with how it was under the Obama-Biden administration when H1N1 broke out and they didn't do nothing. They didn't mount a response. More people were infected. Now, luckily, it wasn't as deadly. All right, they lucked out on that. But they completely dropped the ball on H1N1, and so now you want to trust them on how to respond to COVID? Really? So we know he would have delayed response. Well, what would have happened? That would have meant that it would have spread much further, much faster, beyond our medical capacity to handle. A lot more people would have died. But more importantly, he wants to go off and talk about, jobs. Now, because of what Trump did, not only doing the task force, the travel ban, and warning the public during the State of the Union address about the dangers of COVID and throughout his campaign speeches. So Trump was taking this seriously and taking action and telling us what he was doing to try and safeguard. But zero deaths was never an option. Now, when it comes to jobs and the economy, okay, so Biden says the longer people are unemployed, the less likely they'll ever get those jobs back. But then Biden and Harris want to shut down the economy, put more people out of work and keep them out of work longer. Trump already shut down the economy once, and now we're trying to recover from that shutdown. And whether or not it was right to shut down the economy to begin with, that's up for debate. Okay? That's up for debate, but he took that step. But we can't keep the economy shut down forever. But Biden and Harris, they want to shut it back down again. Throw everybody out of jobs again. Put people back on unemployment again. Those who have regained their jobs, he wants to toss them back out. Which would destroy the economy. And if you go based off of what Biden is saying about, what the job situation is under Trump during the coronavirus, after having shut down the economy once, it's interesting to see him attack President Trump on jobs when Biden says he will take the action again and make it more prolonged, the very action that led to the job losses. So it's like, once again, he's trying to go through and take Trump's plan, pass it off as his own, while at the same time trying to attack Trump implementing the plan that Biden wants to copy and repeat. Only Biden do it slower in doing the response and the initial response, and then keeping the economic pain going longer by keeping people out of work longer. You have to be crazy to vote for Biden. You have to be insane to go along with this plan. And Based off of what the Democrats are trying to do regarding the 25th Amendment, they know that Biden has slim to no chance at winning.
In the search for solutions, two companies that make antibody therapies hailed by President Trump have asked for emergency authorization to give them to more COVID patients. But is political pressure rushing the process? With more, here's Kristen Dahlgren.
On the same day, the president touted an experimental antibody treatment as a cure for COVID.
I felt good immediately.
Two companies who make the treatments applied for emergency approval from the FDA. Eli Lilly and Regeneron say their antibodies made in the lab mimic the way the immune system fights infection.
This antibody blocks that sort of infective nature of the virus by not allowing it to get into cells where it can replicate and, infect patients.
Last week, Regeneron released early data from trials that included 275 people and found patients given the antibody cocktail cleared the virus faster with reduced symptoms. Doctors point out the president took several different medications, so it's impossible to know what impact the antibody treatment may have had.